All right, so I'm going to start with introducing myself. My name is Khadija Al Sharif, and I'm the Child Protection Advisor at Child Fund International. And today we will be talking to you about our different Children on the Move programs. So I'm accompanied with Maria Demora, who is our Senior Project Coordinator at Child Fund Ecuador, and Ceci Ortiz, our Project Manager at Child Fund Mexico. I feel like I'm a bit echoey. So I don't know, like, okay. Is it okay with everybody? All right, brilliant. And not to say the least, the driving force behind all of our Children on the Move program is Radwa Almensi, who is the Director of Protecting Children in Crises at Child Fund International. She could not be here today, but she's here with her heart. So, okay, all right. So today we will be going through our evidence review that we have done on our three main Children on the Move programs in the Americas. We will go through it quickly, and then we will have a deep dive into two of our flagship programs, the Lives in Dignity and the Protective Passage programs. And then we will have an interactive activity with all of us. So I hope you guys are fresh in the morning and ready for that. Okay. So basically, what we have done in our evidence review is that we reviewed evidence from three projects operating across Central and South America and Mexico as well. And we tried to really demonstrate the programs across all of the migration cycle. We tried to provide comprehensive support to children on the move for the past 7 years. And we use those results, and this is what we're hoping for, is to use those results to really try and communicate them, to be able to inform best practices, to be able to expand on them, and make it as scalable as possible. We used a standard method for our systematic review for each of the evaluations of those three programs. We used interim and final evaluations, progress reports, we used monitoring tools, and then we combined all of those evaluation studies and conducted this evidence review. And we used those results through pre and post outcomes. All right. So the first project I'm going to be talking about is Confeo. Confeo is mainly focused on prevention. It was actually funded by the Government of Canada, and it took place from 2017 to 2020. And it took place in Central America, in Guatemala, Honduras, Nicaragua, and El Salvador, and in Mexico as well. Confeo really tries to work, or tried to work, on the pre-migration stage of the migration cycle. So it is at the heart of prevention, and we try to improve the well-being of children and youth who are at risk of migration. We try to support and create livelihood opportunities, for example. We try to provide scholarships, apprenticeship opportunities, linking youth with formal jobs and internships, and also engaging their local civic engagement as well. Throughout doing that, we also built the capacity of the social service workforce and try to develop child-friendly materials to be able to enhance the livelihood and the vocational training of the youth. And through that, we also, of course, put the child protection at the heart of that. So we included components of violence prevention within all of those child-friendly materials. For protective passage and lives in dignity, I will just give a glimpse because I will leave those two beautiful ladies to really dive into them. But Protective Passage is also one of our really flagship programs of Children on the Move. It is funded by the U.S. Department of State PRM. It took place from 2021 to 2022, and it really worked on protecting children during the migration, so in transit youth. So this is kind of like, the second stage of the migration cycle. And it was specifically in Mexico, because Mexico is a country, of origin, transit, return migration, and internal displacement. So what we try to do is follow and really mainstream child protection within this program. We try to provide comprehensive care services. We supported existing shelters, creative pop-up ones, placing technical professionals, for example, like social workers and lawyers, to support the referral and the processing of any child protection cases. And by really putting child protection at the heart of this, we try to provide all of the necessary basic needs. So through service provision, such as like accommodation, education, safe spaces for children, and comprehensive care services that included different professionals, so nurses, psychologists, lawyers, doctors, and so on. For lives and dignity, and you can see how we're like moving from one stage to another throughout the migration cycle, which will we quickly give a glimpse on as well. Lives in Dignity is a cross-country program. It took place between Ecuador and Peru, and it was funded by UNOPS and the EU. We try to build productive and protective communities at actually both the host and the migrant communities. And this is something Maria will also deep dive into. And what we try to do is combine economic strengthening with child protection together. So we worked with the whole community. And at Child Fund, we usually follow a systematic approach. And we go through all of the different levels of the ecological framework. So we try to work really with the children, with the youth, with their families, but also with CSO, all the different civil society organizations, the local communities, the official stakeholders, everybody. And we tried to mainstream child protection through all of this, but also following and integrating, more importantly, a gender and inclusive approach. And this is something that we will be also touching upon. So just a glimpse of what we've done. We facilitated the creation of jobs and apprenticeships, for example, and startups. We reduced all of the different institutional, economic, and social barriers to education. And we included, of course, the educational component, which we will be talking about in depth. We created safe spaces and protective spaces. And we also try to really put all of those different protective methodologies through both the host and the migrant communities throughout. So, all right, so this is the cycle of migration. And as you can see, like we put here each of our programs and which stage of the migration cycle they lie in. And you can see that although each of those programs were initially targeted for one specific stage, as a matter of fact, throughout the implementation, we really realized that it covers more than that. Right? So for example, we've got the Confio in our pre-migration stage, transit, and arrival and integration, whereas we have the protective passage in transit and integration and return, as well as the lives in dignity as well. So among the common program characteristics, and I deeply apologize for the font issue, something happened with the transition and the presentation over here. I promise it was not like that. So yeah. So among the common program characteristics, again, as I just mentioned, we really tried to cover all aspects of the migration cycle within the program. So even though they were specifically intended to one stage, but we holistically try to address all within or throughout the implementation of the program. So we try to reach the aspects in general, the key aspects of the cycle of migration, and that was key during the implementation. So this is like the transit, arrival, integration, and return section. So for the localization approach, and I think this is something that we have been hearing over and over again throughout this week, and the importance of the localization approach, and I really cannot really highlight enough how the capacity strengthening of local partners were key, and the local community members as well were key during our program implementation. And the child protection mainstreaming throughout the educational support was truly invaluable throughout our programs. We provided basic support, so like providing just books and toys for children, but we also took it more on the family strengthening and the parent engagement. We included violence prevention in schools, for example. We tried to enhance awareness and enrollment regardless of the immigration status or the documentation of the child. We really tried to work on dropout prevention, teacher training, including also emotional regulation, inclusive education, and so on. This is actually where I really want to try and focus on. And the font is really getting to me, but I apologize. So I will start with protection. These are like the positive program outcomes that we have really found out that shown, they were shown during the evidence review. So with protection, we have found an increased access to services. So there was a 32% increase among gender-based violence survivors who started receiving referrals and information on GBV services. And another statistic that was actually quite heartwarming was that there is a 37% increase in feeling safe within shelters. And I don't want to just keep saying numbers. I will actually ask Ceci to just give us like a very small story behind this 37% increase in the feeling safe in shelters. So, Ceci?
Muchas gracias, Cadilla. Y para esta parte me gustaría compartirles el testimonio de una mujer trans que recibió servicios psicosociales a partir de nuestro programa, y me gustaría leer directamente su testimonio, y que dice: yo este camino lo comencé sola. En todo el camino me he sentido muy sola, muy desprotegida, y este acompañamiento que me han dado me ha hecho bien, porque me he sentido en familia. He sentido que hay personas que están pendientes de mí y dispuestas a ayudarme.
Thank you. Thank you so much, Ceci. Beautiful. All right. So with migration and the knowledge and attitudes, we've actually found that 2/3 of youth reported higher knowledge of irregular migration risks. And something that we did not intend, or it came out like as a surprise for us, is that 25% of youth actually reported a reduced intent in or to migrate in the first place. They have shown reduced belief that their lives would be better if they migrated, so they actually had a lower intention in to migrate. For youth agency, we have had 24% increase in community civic activity participation. And for livelihood strengthening, we've had 2/5 of the youth who reported being employed towards the program's end, whereas over 1,210 displacement affected persons have received livelihood support and actually reported entrepreneurship as well. And last but not least, because I'm a mental health advocate as well, and a community psychologist, so I really believe that throughout our child protection principles of do no harm, we can't really do any of that without considering the mental health and the psychosocial well-being of children, youth, their families, and the communities. And so just to give a glimpse on the mental health and psychosocial well-being outcomes, we have seen an overall enhanced mental health among all of community members. We've seen 35% reduction in children reporting mental and psychosocial distress symptoms, and from 0 to 216 children have reported reduced diagnoses of special educational needs, and they have received services that were complemented with therapy. 2,504 persons received psychosocial support services, and as part of also caring for the caregivers, we didn't only want to focus on the children but also for their caregivers, so we've incorporated teachers' mental health and well-being as well. And we have teachers who were open more to learning about mental health and self-care strategies, with a beautiful percentage of 39% reduction in anxiety and stress symptoms for teachers, and which actually was measured during the using the Beck anxiety tool. So Maria actually has also a very short story about one of the teachers. So Maria, would you like to share it with us?
Sí, yes, I'd be pleased to share with you this story. Many of us who work with children, we come along teachers. They have an educational community of 2,000 students. They have students in the morning and the afternoon, and they have only a single person in the psychology department who can address and help mental health for kids and girls and boys. When we arrived, there were 42 teachers. Half of them were one group and the other 21 were another group. When we tried to mainstream it and to address stress and everything that generated after the stress and everything that they go through as teachers, we were able to reactivate the dialogue in that educational community. And we have one person, Mrs. Normita. She said, when you arrived, we realized that talking is important because many times silence destroys educational communities. If the teachers are silent, you can imagine how silence will be among students. If the teacher is not part of dialogues, they won't dialogue either as a student.
Thank you. All right, so just to wrap it up really quickly, we have got like a couple of lessons learned throughout our three programs. One of them is the extended implementation period. So, this is something that we've realized is very critical in order for us to have the necessary time to build the relationships with the local actors and the local partners and the community members. Sometimes, because of the humanitarian funding, we are required to do things in a rush, but we really are asking for extended times to be able to really implement and actualize this localization approach that we are all trying to work with. We have had direct community engagement as well. This has created or increased actually accessibility and acceptability of the programs. We've had partnerships with relevant authorities and stakeholders, and such actually created um, a sense of sustainability within our programs, because even if the funded program is over, even if child fund is not there within that community, for example, the more that we have those partnerships, the more that we can try and ensure this sense of sustainability, because as organizations have, for example, a high turnover, this sort of partnerships may really ensure the continuity, maximize the efficiency, and avoid any duplication, for example, or diverging approaches as well during program implementation. Um, for the interinstitutional coordination, it's shown to be very critical, because to address the holistic well-being of the child and their families during migration, we really need to address all of the different needs. And to do that, we need the support of all of the different institutions that we can have on the program as much as we can. And all of those four components that I've just mentioned are all key to our localization approach. So, working in general with strong local partners and organizations, it's really key for program success and progress, for flexibility, for responsiveness to any changing of the context. So, it all lies within that specific theme. And again, as we have seen, this is an emerging priority that keeps popping up in each of the different sessions. I will end by saying quickly the audio-visual communication and art-focused interventions were also a key lesson learned of how this can reach communities that, again, would not necessarily respond as well to the different forms of messaging. And we actually had a very interesting example when during one of the lockdowns, because of the security situation, we have had a theater and we've engaged a theater for all of the different youth to address teenage pregnancies, which has shown major success. Smart indicators as well, reflecting all of the migration cycle. We need to work better on that in our coming programs because we need those smart indicators to access all of the different migration cycles, even if it was not intended initially, but because we have realized that there were effects and there were outcomes that were not necessarily intended for certain migration stages, but were, as a matter of fact, reached. And also, one other thing is that when I say here, like applying a gender and inclusive approach, we have been able to measure our gender indicators because we've included them. However, even though we've had successes, for example, with children and youth of the LGBTQ community, we were not necessarily able to capture this in terms of numbers because we did not include such indicators. So this is also like a lesson learned for us. So for smart indicators, it also has to be inclusive and again, like going back to the applying a gender and inclusive approach, it has shown to be key, and we will be diving more into the gender approach in the programs. So I've taken very long, so now I would like to please move on to my colleague Maria.
Very well. At this time, we're going to go on to Spanish, and we have a little video we'd like to share. At your tables, you have the material of our results in regards to the management of child fund, humanitarian child fund. So we have the capacity statement of Mexico and Ecuador. There you can see the numbers that Kabilha has spoken about, the activities and strategies that we have started. Let's start out with the video from Ecuador, please.
En Ecuador, las personas migrantes y refugiadas circulan libremente por todo el territorio. La emergencia humanitaria por el desplazamiento masivo de personas está en las ciudades con mayor población urbana y en las zonas de frontera.
Mi emprendimiento es confeccionar bolsos, mochilas, monederos, todo lo que referente a eso, ¿no? Las capacitaciones de Child Fund me ayudaron mucho, porque pasé de hacer unos bolsitos sencillos que no tenían nada de fabuloso a hacer unas carteras, bolsos que pues bonitos.
Gracias al apoyo de la Organización Internacional para las Migraciones y con el financiamiento de la cooperación española, el proyecto Semilla se enfoca en la integración de mujeres migrantes y ecuatorianas.
Antes no tenía con qué conectarme para hacer mis deberes.
Le agradezco que las compañías que han dado, que ojalá sigan más así la tecnología que avanza y también ve por las personas que somos de bajos recursos y nos ayuda, pues entonces estoy muy agradecido también eso.
Gracias al apoyo del Consejo Noruego para Refugiados y con el financiamiento del ACNUR, en 2020 alcanzamos a 526 niños y niñas de 5 escuelas públicas en la ciudad de Ambato.
Un cuidador comunitario lo que hace es ayudar y verificar a los lados más vulnerables, especialmente los niños, niños de inmigrantes, en los cuales estamos obligados, sería la palabra, de cuidar, proteger.
Gracias al apoyo de la Organización Internacional para las Migraciones y con el financiamiento del gobierno de los Estados Unidos de América, en 2021, Child Fund creó capacidades con voluntarios jóvenes, adultos y de la tercera edad. Gracias a la confianza y financiamiento de nuestros donantes, Child Fund puede construir comunidades seguras y protectoras. Logrará que más familias tengan un medio de vida digno y que la niñez sienta una verdadera inclusión educativa en Ecuador. Te invitamos a apoyar el desarrollo y la inclusión de todas las personas, sin importar su nacionalidad o situación migratoria. Con tus aportes, podemos construir comunidades de paz unidas por la solidaridad y la riqueza de la diversidad.
Thank you. As you can see here, we have the testimonies of the three areas of our work. In the upcoming slides that we're going to share a little bit more profound lives with dignity. Let's go ahead to the upcoming slide. As it had mentioned, it has financing from UNOPS and also from the European framework. And the work that we have on the territory, the humanitarian assistance toward development, it has worked the best for those who know the reality in the region. Ecuador is a very important country of transit for migrants. We have had many migrant waves starting for the Ecuadorian. It's a population that has always been a migrant. We're having the second wave of migration leaving from Ecuador. We have received a lot of people from Colombia. They have 60,000 refugees recognized from Colombia. And currently, we have around 100, we have 100, 500,000 Venezuelans at our territory and refuge. And how is our work? We have economical inclusion and we work on means of life in livelihood. And the second one is inclusion in education. And then we have a parent, a father, a child working closely, promoting security and protection at schools and also in the communities. And we have the protection and its development. It's like connecting finally the well being of boys and girls in the communities with the development and how migrants can be seen as people that contribute to the places where they arrive or those whom are looking for a better way of life. In Peru and Ecuador, we're in Cuenca and in Guayaquil. This is in the south of Ecuador, where I come from, and in Peru, in Libertad and Piura. So we want to show you in the next slide how the strategies have been a challenge because what we have done is work with alliances and with partners. First of all, we all agree that the national authorities and the local governments, the Ministry of Education, Childhood Protection, are indispensable for this type of work, just like the other NGOs. In Ecuador, fortunately, we have the work very well developed, the work on refugees and migrants, and the mechanisms of work table divided by sectors, tables of WASH, and to make it more dynamic as organization based upon the first challenge. What do we work on in depth? An area related to training, another one related to investigation, and another one with innovation. Let's start off with training, just to reflect that the humanitarian workers, we realize that training is thought of always for people that are going to be there on the long run, whom are residents who are there long term, can study 6 months, a year, to get to do something. But migrants, let's say a mother or a person in charge of a home of a migrant or refugee, it's not a reasonable time frame. So we cannot give them skills for entrepreneurship and also to work because this works with the traditional programs of training for work and employment are not appropriate with a migrant mother that has children and she has to take care of them and does not have a supporting system while she goes and study. So it is very important for us the learning what's done through universities that they can open these possibilities with certified training and sensitive to the situation of the migrant mothers. In regards to investigation, I think that all the humanitarian workers whom are here, we recollect data, we do surveys, and we have an immense amount of non-processed statistics that have not been analyzed and not compared. For us, this is the first challenge in this project because we have gotten a chance to get involved the Catholic University of Peru and also of Cuenca, the faculty of social science, that they can do some binational studies. With this information that we got, what do we do? What do we do? How many of you have gone back and checked of the diagnosis and the prioritization of who's going to participate in the program, who need or who not, have written in evidence that can reflect, look, this is what's happening. Look at what's happening with the children. Look at the risk. We are finding, what are we finding on the terrain? We're going to give them the humanitarian part. We're going to reach out to them to control the shelter, to give them an opportunity of entrepreneurship. But where is this evidence published? Nowhere. And I want to leave this reflection with you as a humanitarian entity. We can do investigation based upon the data. We have to protect the name, we have to protect the location, but all the other realities have to be systematized to leave evidence towards the authorities who have to ensure the rights to build public policies and also that the humanitarian work is well valued. So we're fortunate to have an investigation, a published book, the first investigation that is related with the migration work and also with the human trafficking. There's a comparable study that was done in Peru and in Ecuador, adapted to the national context. And the Chalfa in Ecuador, very soon you're going to get to download the book. Finally, with innovation, we wanted to let you know that we were happy to work with our ally. We work, does the same work, we world in Peru and Chalfan in Ecuador, but it's always a challenge with allies to agree and it's always good. We have our own methodologies. We follow the procedure of child fund. Why would I ask Red Cross or why will I ask Save the Children how they do it if I already know how to do it? But if we really want to be a humanitarian alliance, we have to work together with the members of this alliance who are part of the same work group. And we have to reach upon minimum agreements. The standards are there, but the operational work and the territory of coverage and those on terrain. How are we going to do this? Can we do it together? 2 years, it has been possible. We have had a perfect experience. And on the two sides of the border of south of Ecuador, execute in Peru and execute in Ecuador, a successful program with displaced migrants and families. Upcoming slide, I want to tell you what we think is innovation in regards to protection. This focus on protection that we want to give to those who have been forced to migrate has to do with two components. The first one is the integration or integrative education in which there you can see is a strategy that we have already spoken about these days. But this education inclusion is not sustainable if we cannot get the socio-economical inclusion for caregivers, for the parents. We say we have to work in protection, yes, but we have to ensure the livestock integration, xenophobia prevention for sure. We're going to have to work with other actors far and beyond only than childhood, national authorities and other authorities that participate with the well-being of childhood, and not all of them have the same comprehension of protection for children. So something we can tell you is that the innovative protection, that differentiation that we have to do in protection is to work with the families, to work with the community, with the local authorities at the same time. Is not only a work at the schools or only the communities. We develop these strategies in three work areas and all of them in a timely manner together. And all of them to do advocacy with all the authorities, the close up with the community. And in this work, all of them alongside. If we don't do it that way, there will not be a balance. In this last slide, I'm going to share with you how is it that we do monitoring because it's quite interesting for us. The program Lives in Dignity has some focus of implementation in the region in Ecuador and Peru. We are the ones who are implementing, and we have a dashboard that allows us to monitor a lot our reach towards people, how many are host communities, how many are children, how many are adults, how many are elders. We have an important percentage, and there's always a number that calls our attentions and lets us see the reality of Ecuador. Why is it so high in the host community? If it's a migration program, refugees, what do you think? Because it should be like a 70% refugees. And that's what the conditions of the donors tell us. Why? In Ecuador, what happens is that the host communities, the one that's receiving the Venezuelan brothers, and we still continue receiving Colombians. Lately, the host community is the one that wants to migrate. They are the ones that are migrating. In the last year, 200,000 people left Ecuador. At least 50% of them crossed through El Darién, through Panama to the US. And then we realized that the humanitarian work, when it's in regards to children migrating, has to open their eyes to the children arriving, but also the children that are exiting, the caregivers that are exiting, because the children are staying by themselves. And at the school, we have a great amount of children in the rural schools where we work in Cuenca. 30% of the children are without their parents. They're with caregivers, uncles, grandparents, other families, and their children affected by the migration. Yes, they're not migrants, they're not migrating, but they have been affected by migration, a forceful migration caused by violence, criminal actions, and everything that has to do with safety in Ecuador. And somebody has to look into it. Humanitarian workers, we're not only focused, we should not only open our eyes for those arriving, but the boys and girls that are staying by themselves without parents and caregivers affected by the migration. With this, I close my intervention. Go ahead, Sassy.
Ya, muchas gracias,
Thank you,
María.
Khadija. Thanks,
Muy
Maria.
buenos
Good
días a
morning to
todos
one
y
and
todas.
all.
Antes de
Before
comenzar
I
con mi
begin with my
presentación, me gustaría
presentation, I
pedir el
want to
apoyo
ask you for
para
your
presentar
support
nuestro
to
video, por
present
favor.
our video, please.
Nos tocó pasar días, noches por una selva con nuestros hijos, luchando, viendo la manera de buscar un bienestar y un futuro para ellos. Y con fe creemos que le vamos a dar un buen futuro a ellos. Esto es todo lo que puedo decir.
We're going to give them a good future. This is all that I can tell you.
En la solicitud tenemos un apartado donde ustedes van a narrar por qué salieron de su país, sea por amenazas, por la economía, por la política. Yo los puedo ayudar. De hecho, ahorita estoy atendiendo a unos chicos y pues vinieron a que yo les hiciera la solicitud de refugio, les ayudé a llenar toda su solicitud. Ahorita vinieron para que yo los pueda apoyar para el trámite de su visa por razones humanitarias.
They came for me to help them with their humanitarian visa.
Podemos atender, todas las atenciones son gratuitas. En dado caso que por alguna razón no pudieran o la persona que la necesitara no está, ahí viene un número, pueden mandar un mensaje por WhatsApp para agendar una cita con nosotros y algo en la oficina.
Hemos detectado las zonas donde ellos radican más.
Nos hemos encontrado con muchas personas que desconocen de que hay ayuda médica, ayuda psicológica, ayuda legal.
A
Le
lot of
recomiendo que
people
vaya a migración,
that
a
don't
Comar,
know that
3,
there's
la que está en
medical
el
and
centro.
psychological
Llévese su
assistance.
constancia, que es la que
I
tiene su
recommend
fotografía,
that you go
y
to
vaya a
Comar's
preguntar
office
a ver
that is
si ya hay una
downtown.
fecha para su entrevista
Take your
grabada.
group that
Yo
has
aquí
your
tengo la
picture
crema,
and
esta,
go and
¿sale? Pero
ask
antes
if
de
there's a
aplicársela
date
se
for your
tiene que
interview.
lavar toda la zona
You
de
will
las
use
piernas
this
bien, en la
cream,
mañana
but
y en la
before you
noche.
have to
Principalmente nos
clean your
movemos en lo que
legs,
son
clean off your legs.
colonias.
You should do this
Colonias
in the
o
morning and in
espacios,
the
ya sea por ejemplo
afternoon.
Comar, tenemos una
We
brigada, tenemos
provide
espacio
cares
también con otras
in colonies
organizaciones,
or
también
spaces.
los centros de salud
So
o
in
las
Comars,
dependencias
we have other
gubernamentales
organizations.
hicieron un límite de
The health
pacientes y pues
centers
ya ellos, como es la
and the
población
government
extranjera,
centers
migrantes,
have a
pues los
limit of
hace
patients.
a un
So since
lado.
it's the population, the foreign
Cuando yo
migrant
te diga, vas a
population,
jalar aire, lento pero fuerte. Así,
they're
mira,
set aside.
saca
When
por
I
la
tell
boquita, ¿sale?
you, you're
Cuando yo te
gonna
diga,
breathe in deeply.
¿puedes respirar?
Now,
¿Otra vez?
breathe out when I tell you
Yo
to.
vengo de
Can
Nicaragua,
you breathe?
he podido
Once
tener la
again,
oportunidad pues
I'm
de
coming
que
from
me
Nicaragua.
asesoren
I've
legalmente
had the
con
opportunity
respecto a mi
that I
proceso
can get legal advice
de obtener la
in
credencial
regards to my
permanente dentro del
process
país. Aparte de
to
eso, pues la
obtain a
consulta médica
permit
gratuita que nos
permanently
brinda
in
la
the
doctora
country
Alexis. Y pues de una manera
and
muy
the
amigable
free
somos
medical
atendidos.
care from Dr. Alexis.
Nos brindan el
And
medicamento
she has been
gratuito.
so kind the
La
way that they
atención
have
igual es
attended to us.
gratuita.
They give us medicines for free and the care is free.
Caminos protegidos, en verdad sí, sí me ha ayudado muchísimo.
So
Ellos
we
siempre
were
me brindan
protected.
una mano hermana, una mano
It has
ayuda.
helped us a lot. They have always given us a hand, an assistance.
Esperamos que ellos nos sigan apoyando y para que juntos pues sigamos llevando a cabo esta misión de poder ayudar a la población en movilidad.
Camino Protegido nos ha venido a dar una gran solución a tantos problemas que enfrentamos a diario con los migrantes.
Camino protegido, camino protegido, camino protegido,
Camino protegido.
camino protegido. El granito de arena que uno puede contribuir es algo significativo para ellos y eso es algo reconfortante también para nosotros.
Siempre quise poner mi profesión en algo que también sirviera como para ayudar a las personas.
Yo me siento muy contenta de pertenecer a este gran trabajo, a este gran equipo multidisciplinario y sobre todo muy orgullosa. Algo que me gusta mucho es que va ligado mucho a mis ideales, a mis creencias y a la forma en la que yo siempre quise desarrollarme.
My beliefs, my values, the way that I always wanted to develop my life. Thank you. In the same manner, I want to make use of this opportunity to ask for a minute of recognition and your support with a round of applause with all our teams on the field for those whom are here present, who work directly with the population, because without the help of all of you and every, it would not be possible. A round of applause. Thank you. So I would like to share with you the different experiences that we have had from the Child Fund Protected Pathway. I want to greet our colleagues from Educo who implemented the program in El Salvador through the international plan. They participated in the implementation of this program regionally. We want to send them a warm greeting. Something that I would like to share with you, and that for sure those who have worked or are working on mobility, our population is quite diverse, and the needs and the challenges of the population change constantly. And our objectives are also being transformed constantly. One of the main challenges that the population has is to access services. When they get this access, as one of my colleagues on the field stated, They confront other levels of challenges, xenophobia, discrimination, the language barriers. And that is where we come in. And then we define which is our objective, our central objective as a program, which is to reduce the gap into the access of services, to provide the basic services, sometimes to provide medicine, also protection and psychosocial care. Something that is very important for our program is not to leave anyone behind, that the services will be available not only for those who are refugees, but those who are seeking it, but for those whom are in transit. Another important point is that when we choose the profile of those whom we're going to attend to, in Mexico, unfortunately, we have very high levels of poverty and very high levels in regards to the access of services. So every service that the program offers are available for the local communities and the origin communities. And this not has only helped us that the population will have access to the service, but it has diminished the xenophobia, in which usually when a new organization arrives to the municipalities or to the entities, what we usually would hear, it's another organization that's only here to help the migrants. So it's very difficult, that contact and that communication with the local communities. But when they also have access to these services, then it changes their way of thinking and the integration opens up much more. Now, so where is it that we have these activities and how is it that we accomplish it? Currently, we have a presence in Mexico in two of the most important borders, south border in Chiapasita, Basco. We cover three of the main entry points. One of them is Tapachula, that covers Hidalgo and Telemas and the central corridor, and they come through with Kumalapa border, and it's an entity that currently is completely taken by organized crime. On the other side, Tenosique, and the other spaces in which we have also activities, the North Zone in Tamaulipas, in the zone of Reynosa and New Laredo, is in the complicated context, because unfortunately these are one of the two of the main points in where organized crime is located, and the population becomes even more vulnerable in regards to human trafficking, and they are also captured to become part of these organized crime. How do we work, or how do we implement our program? When we were on the design of this program, we asked ourselves, how are we going to get to the population? It's thousands of people that come into our country. And we asked ourselves, how can we access or help them to access these services? What we did was a mapping of which are the spaces where they're already getting that assistance. And the majority of these spaces already have years providing these services. And generally, they do not have access to economical resources to widen the services or protection that they already offer. So they only become shelter or providing meals. We realized that what we could do was to strengthen the capacities of these spaces and to work together, that there could be more care, the one that we can give to the population. And this way, we have activities in 12 different shelters or offices of care or attention. Very well. Which are the services that we provide? We realize that the complementary services that are needed at these shelters are related to the medical care that can be offered to the population, the psychosocial services that has to do with psychological services, or also social work for the follow-up of these cases. For this reason, we design a strategy of care. We assign multidisciplinary groups to these shelters with a particularity that we don't have not limited activities, and these teams are there continually from Monday to Friday, providing these services on a regular schedule that they can access, that the population can access these services. One of the commitments that we have with this is to make it that the population can feel dignity when they're transiting through our country. The four professions that we can assign to the spaces are from the area of medical attention, psychological attention, social work, and legal. These teams work through three main areas for us. And the first objective is exactly the access to health with an access in the first level of care. What our teams do is that the common illnesses, chronic degenerative diseases, which are constant in our population, gastrointestinal and respiratory diseases, curing allergies that come many times at the majority of the population that we receive or coming from a pathway from El Darien, as our colleague was sharing with us, and then they're affected and they arrive with this to our zone of implementation with these problems. The two other objectives that we have them as individual objective is something that we work on together hand in hand. And one of them is a topic of protection to children. And one of them has to do with violence based on gender. They can look like different topics, but for us, they go hand in hand, intersectorial. And in both of them, we work on strengthening the capacities of our teams that we can identify the needs and do the necessary referrals. And a great challenge that we have on both of them is to facilitate or improve the relationship at the shelters with the government. Unfortunately, in our country, there's a lack of trust to go to the public institutions, and part of our work is to soften this and to share the importance of collaborative work. Another important component for our program is the response that we provide and what we refer to the emergency in emergencies. The population that comes into the country, that the shelters are not enough and they're at their maximum capacity, and the majority of the population lives in irregular places, improvised places. So we have the task that we're the ones that take the services to the population in the communities and in the crisis. Amongst them, the caravans. The caravans, we don't experiment them like it was in 2018. But the reality is that our spaces, we still have these vast group of people that are transiting through the country and that are requiring the care at that moment. Another aspect that is important for me to share with you, and I'm very happy that I can talk about this topic, is self care with the teams on the field. So we have the commitment of the responsibility that our populations are not the only ones that we take care of and on site, but those whom give the services. We are proud to share that we have a low index, or low numbers of those that resign. We have colleagues that have been with us from day one until now, whom are working on the topic of mobility. We know that it's very difficult. Generally, the teams on the field only last a couple of months, a year, and then there's a change of personnel constantly. But the strengthening of this culture of self care has been important in implementing the services.
Sorry. And just very quickly, in this section of self-care, something very basic that we can implement is to name it, point it out. Unfortunately, many of our teams on the field come from contexts where um, they didn't get support on this topic. So just naming it, pointing it out, remember that something that you don't talk about doesn't exist. So we have to promote it within your teams. And going very briefly over these statistics, these 73,237 is about the amount of people we have provided attention to. And on average, every subject has received 2 to 3 sessions. So we can estimate how many sessions we have covered. Out of that, 27% of our population is boys, girls, and adolescents. And I am going to cover this briefly because we already shared our partners, but we're going to retake this later on. The importance of collaborating with other agencies.
Thank you. We're done, no? Done? 5 minutes? One more. Okay, this timekeeping job is like super difficult, so I apologize for running a little bit late. Thank you so much, Ceci. We have 1 minute left, as a matter of fact, so we would really like to do this Menti exercise very quickly with you guys. So if you would please scan the barcode.
Thank you very much. And we are going to answer this. If you can scan that code, or perhaps you can see the access code if you want to use. First question is, where are we from? I am going to, yeah, we can switch the slide. We can see the responses of the ones who have finished. Where are you from? So we have people from Colombia, Brazil, Iran, Afghanistan, Guatemala. Thank you. Thank you for sharing your uh, countries of origin. In which areas do you work on? You can choose one, you can choose several. If you can click which thematic areas you worked on. So I think many of us work on education, on child protection, most of us. So you can see that ranking, how we're supporting and where we could work together would be interesting. Next question. Strategies to promote education inclusion you have done during the last 4 years. You can choose one or several of the ones you have worked on the field. We have online education, accelerated learning. We know it's a challenge and strengthening of teachers, but doubtlessly we work with learning community centers is the most common one. The next question is the agreement or not we have on strategies to work on health and mental health. We have this responsibility of providing services that are definitely denied to most of the population in Latin America regarding health and mental health. We have mobile clinics, psychosocial support, self-care for caregivers, for families, teachers, psychological first aid. We all share the same thought that we know that mental health is important and to take care of the caregiver. Thank you for your answers. Next question is protection mechanisms your NGO has used during the last 4 years. Regarding protection, we know the challenge of having regular document, visa, having the app for refugees. It's important for people who arrive to a new country without knowing the context or the reality, and also legal rights. Very good. So let's go to the last question. So one more. Domenico tells me that we have to wrap it up. Okay, so what's the reason why you wanted to leave your name here? These are the names that make a difference and make a difference in humanitarian work. So thank you for sharing your experience with us.
All right. Thank you very much, everybody, for attending this session with us. And apologies for running a little bit late. As we can see, just like very quick closing remarks, we have seen across both programs and the other third program, Confio, that I have mentioned within the evidence review, quite overlapping themes, as a matter of fact. So we have discussed the importance of having a multi-sectoral approach towards any Children on the Move program. We looked at the importance of really integrating mainstreaming, of course, child protection while integrating a gender and inclusive approach, mental health as well, livelihoods, education, and so on. And we have talked endlessly about the importance of the localization approach and our local partners. So thank you so much, everybody, for attending this session, and please reach out to us. So yeah, thank you. Thank you, everybody.